Mark, turning now to medical rounds. Digestive disorders are all too common, affecting nearly 70 million people in the U.S. That's according to the National Institute of Diabetes, Digestive, and Kidney Diseases. So what can we do to reduce that number? Joining us live tonight is Dr. Parikh. He is a gastroenterologist at Hartford Hospital to talk to us about ways we can keep a healthy digestive tract. Good evening, Dr. Parikh. Thanks for being here tonight.
Good evening, Denise. Thank you for having me on tonight.
Well, let's get started right away with this question. How can we maintain a healthy digestive tract and reduce the number of these digestive disorders?
Well, when I think of healthy digestive diseases, I think of the association between obesity and the gastrointestinal health. We often think of obesity affecting cardiac diseases and diabetes, but in fact, obesity also has significant negative consequences to the gastrointestinal tract.
So,
for example, being overweight actually increases your risk of gastroesophageal reflux, fatty liver, pancreatitis, and cancers of the colon, esophagus, and the pancreas.
So it's just another good reason to try to keep your weight at a normal level. And can exercise, speaking about obesity and trying to lose weight, can exercise reduce your risk of these diseases like it does for cardiac disease and diabetes?
Yes, in fact, exercise and weight loss can reduce the level of inflammation in your body in conditions such as fatty liver and can actually reduce symptoms of acid reflux. Interestingly, on a slightly different note, recent studies have shown that exercise can affect your gut microbiome, which is the composition of good and bad bacteria in your gastrointestinal tract. These same studies have shown that high-intensity exercise may in fact increase the proportion of good bacteria versus bad bacteria, which to me is extremely fascinating because we're just starting to see multiple links between the gut microbiome and gastrointestinal diseases.
That is interesting. I have time for one last question. We hear so much today, Dr. Parikh, about probiotics, now prebiotics to feed the probiotics. What kind of role can they play? Should people be taking supplements, or is a good balanced diet enough?
It's a great question, Denise, and it's one that I see on a daily basis. So just like the interplay between the gut microbiome and gastrointestinal diseases, we are still awaiting definitive studies to tell us exactly where probiotics and prebiotics fit into our treatment paradigms. For certain conditions such as antibiotic-associated diarrhea and specific cases of inflammatory bowel disease like ulcerative colitis, probiotics may definitely be helpful. But in my opinion, the jury is still out if probiotics are going to play a role in other conditions such as irritable bowel syndrome.
All right, good to know. We'll wait for the research to be conclusive on that.